I can't emphasize enough to this day how important the Alzheimer's Society has been. Arlene at the Alzheimer's Society was an absolute sweetheart. She arranged a meeting for the entire family. Our two daughters, their husbands, our niece, who used to work with Teddy all the time in her quilting, Rick, our son in Winnipeg, was included in this by a video conference, and it was the meeting that has saved us, saved all of us.
The Alzheimer's Society is, without doubt, a necessity. Our clinics are very busy and we don't have the time that they will spend with both patients and their caregivers, giving them the information they really need. The Alzheimer's Society can really assist you in helping those patients and their families on their journey. They will save you time by helping them manage different functional impairments with different options for what they could do instead.
The way that they described what was happening in Mom's brain and why she was forgetting things. They described it as a roadway, and these boxes were falling off this truck and blocking the roadway. She had to navigate through that to try to get her point across. The boxes have become bigger over the years, and we actually now changed it, that there's these giant sea canisters that are blocking her pathways. They educate us on how we can actually communicate with Mom, reminding us the importance of touch, of music, of trying to introduce other ways of not just verbal communication that would really help in perhaps reassuring and relaxing Mom.
It's a very simple process to refer somebody to the Alzheimer's Society, even for very busy clinicians. Basically, all you have to get is verbal consent from the patient or their caregiver that they would like a referral, and it's a simple one page to refer. Most patients are very, very receptive and welcome it. And so I find it very valuable. In terms of the different programs that the Alzheimer's Society runs, the one I'm most familiar with is the First Link program. We offer this to every patient diagnosed with dementia, and even some of those who are really eager for information diagnosed with mild cognitive impairment. And so what they're very good at doing is bringing in both clinicians and other professionals to provide the information that a caregiver may need.
They brought in the law firm. They guide us as far as what the requirements were in order to get the legal paperwork, things like personal directive, power of attorney that we would need.
One of the most important things really with the Alzheimer's Society, when I look back on it right now, I realize one thing, and that's we're not alone. There are others out there who are willing, capable, and want to help.
The support they've provided to my dad in particular has been a huge weight off of our shoulders. It's given him answers to things that none of us can answer, and it's really been reassuring for us to know that he has someone that he can look to and get some really good guidance and information and support. We had another family meeting with them, and they gave us, again, another couple of hours. We were trying to understand some of the behaviors. She was very agitated and aggressive, and that's, so contrary to the mom that everyone knows.
There are days when we've gone into the care home and she's yelling and screaming and saying, "I don't want to have anything to do with you, go away." The only way I can manage it from a personal point of view is I have to realize, a sea can fell off the truck. Something happened. And I know it's not Teddy talking to me, it's Alzheimer's talking to me. And in that way, I don't get too upset, and I can go and spend some nice, comforting time with my wife. They really have been a wonderful asset, and I would certainly recommend any doctor, if you're involved in treating somebody with dementia, please get involved with the Alzheimer's Society. It will help enormously for you.
The bottom line, in terms of my opinion about the Alzheimer's Society, is that it saves me time. It provides so much information, particularly for the caregivers, but also the patients going through a dementia journey, that I couldn't manage my practice without it.